It is a disease that about 29 million Americans live with, and if you have diabetes, you know it can be pretty hard to manage. Here to tell us more about the disease and how to better live with it is Dr. Carolyn Allman. Thanks so much for joining us here this morning.
Thank you so much.
First off, just go ahead and tell us, what is diabetes and what causes it?
Well, diabetes is a condition where you have elevated glucose levels in your system, and it can be caused by many different things, but the main thing is if your pancreas is not working. It either is being destroyed by the body cells, or the pancreatic cells are not are resistant are pretty much resistant. That's what it is.
And I understand there are different types of diabetes.
Can
you elaborate more on that?
Well, the four main categories are type 1, and you generally see that more so in children. There's type 2 diabetes, which generally you see more in adults, but with the onset of obesity in children, we're tending to see type 2 diabetes now more often in kids. There's also gestational diabetes, and we see that more in pregnant women, and it tends to go away after the baby's been born. And there's also a condition called prediabetes, where the individual hasn't yet developed diabetes, but they're on their way to getting there.
What are some of the symptoms of diabetes, and how can people be on the lookout, you know, if they may have this?
Well, persons may experience things like increased urination during the day. They may eat a lot more, but yet still lose a lot of weight. They may have some kind of vision loss or blurry vision. Fatigue is very common, and sometimes just a general feeling of not feeling well. And in that case, you really should follow up with your primary care physician and get further help there.
And thirsty too, right?
Yeah, thirsty
Hungry
too.
And thirsty.
Yeah.
And then for those who do have diabetes, talk about some other ways that can better their lives, you know, with this disease.
Well, most importantly, patients should try to continue to take their medications like they're prescribed by their physician. They should follow up very regularly with their physician. But lifestyle habits are very important, and they should try to change it in terms of eating smaller portions of food, getting plenty of exercise, at least maybe 30 minutes a day, 3 times a day, and taking all the medications prescribed by your doctors, like including medications for cholesterol or hypertension.
So be sure to check your blood pressure levels as well.
Yes, correct.
All right.
Correct.
And how can folks find out more about diabetes?
Oh, well, you can visit uamshealth.com, or you can call 686-8000, and we will be sure to give you some information about diabetes if you have any questions there.
Dr. Allman, thanks so much for joining us this morning.
Thank you so much for having me.
Appreciate it.
Thank you.
Well, we'll be